It's great to have back on the program today Nicholas Christakis, Sterling Professor of Social Natural Science at Yale University, also author of the book Apollo's Arrow, The Profound and Enduring Impact of Coronavirus on the Way We Live, now out as of last month in paperback with a bunch of new material, still very, very accurate. Great to have you back on.
Thank you so much for having me, David. It's good to be back on.
So last time we spoke, January of this year, it was very early in the vaccine rollout. You and I spoke a little bit about the societal impact that the pandemic had had to that point. Maybe to kind of get us into the conversation today, are you surprised at the degree of partisanship in the adoption of vaccination since you and I last spoke, or is it in line with what you expected?
No, the partisanship and the sort of ideological way we've approached many aspects of the pandemic has surprised me a little bit, to be honest. I mean, I like the fact that we live in a plural democracy. You know, we do not live in a monarchy or in an autocracy or in some kind of a society where everyone has the same opinions, either because they're forced to or naturally. We live in a society with a tremendous amount of ideological diversity, which I find healthy, regardless of what part of the spectrum you are on. And one of the other things that's a feature of our society is that we resolve our disputes not by force of arms, but by voting. So we vote. That's how we, come to express a consensus. But what's interesting to me, so I like the fact that we have this ideological diversity. But what perplexes me is that we are increasingly, or at least in the setting of the pandemic, we seem to be expressing our ideological diversity via our response to the pandemic. And that's weird. In other words, if you believe in a cause or in a candidate, get a bumper sticker, get a lawn sign. I mean, use a conventional means of signaling your political identity. To signal your political identity by whether you wear a mask or not, or by whether you get vaccinated or not, strikes me as foolish. It is taking something which should be just technocratic and just, non-ideological and making it into something that's ideological. And I think that as a nation, that has harmed us tremendously. We always had some vaccine hesitancy. Typically that originated on the far left, actually, prior to this pandemic. Now we have a far right group that it has a lot of vaccine hesitancy. The people that are vaccine hesitant are a heterogeneous mix of people. Some have political motivations. Others have other sort of, you would say, more sensible concerns, like they're worried the vaccines were developed too swiftly, or some have conspiracy ideas which are easy to rebut. They're just false. I mean, they may not listen to you when you rebut them, but they're patently false. There aren't little micromagnetic chips in the vaccines and so on. So it's a problem. Vaccine hesitancy is a problem. The politicization of our response is a problem, and it's a problem not just for those individuals, but also for our society.
When you look at that combined with, I think another issue to choose one other issue to talk about, and then we'll kind of tie them together. Another thing that's going on in a lot of the discussions of what the path forward is are sometimes kind of inaccurate assessments of the base levels of risk prior to the pandemic. And, in a typical flu season, you would see about 100 people per day die of the flu over the course of the year. Now it's concentrated over flu season, so it's not literally 100 per day, but, we're now at 1,000 or so. And so we kind of are trying to think about how do we evaluate the level of risk that would be acceptable to, quote, go back to normal. And everybody has a different metric that they might be using. Some people are saying the fact that now we need a third dose and they're talking about fourth doses, that's making me kind of throw in the towel and say, I'm going back to normal now because otherwise it seems like I maybe never will. Other folks are saying, well, until we really don't need masks, I am going to live life one way. And then when the masks aren't needed, I'm going to, quote, go back to normal. Others are looking at case numbers, et cetera. What is your general assessment of the metrics by which we should be thinking about going back to normal, and even what it means to go back to normal at this point?
Well, I do discuss all this in the book, in Apollo's Arrow, but let me try to take a stab at that. I think the first thing I would do is to step back and have a high order understanding that people need to understand that our world has changed. There's something new about the world. It was not there 2 years ago. It's a deadly virus. It's not as bad as smallpox or bubonic plague or cholera, but it's not like influenza or chickenpox. This virus kills about 1% of the people that it infects. That's a pretty serious pathogen. That's a serious virus. And that virus was not there before, and now it is there. You can think of it like sort of radioactive rain that is, making every surface toxic or something. It's a new feature of our environment. And I think the idea that we could just pretend it's not there is wrongheaded. Now, there's also some wisdom in accepting the new reality. That is to say, well, the world has changed. That sucks, but let's just accept it. And I understand that point of view. But I also think it's important to understand that we have over 750,000 of our fellow citizens that have died in the last year and a half because of this pandemic, and probably as many as 1 million will ultimately die. And that is a catastrophic loss of life. Hundreds of thousands of our fellow citizens have died. 5 times as many will be disabled by this virus. That people who survive, they don't have long or short COVID. They get over their COVID, but now their bodies are harmed. They have a pulmonary fibrosis or renal insufficiency or cardiac or neurologic or psychiatric problems as a result of the virus. So 5 million Americans will have that. Plus, 10 times as many people as die will be grieving the death of a loved one. That's another 10 million Americans. And so there are lots and lots of our fellow citizens who are going to suffer from this condition. And I think it doesn't serve us well to just, whistle by the graveyard and pretend that nothing is happening. Something is happening, and it's not a trivial thing that's happening. And so it is right for us to consider how to cope with it. Now, we are approaching the end of the immediate phase of the epidemic when we reach this herd immunity threshold. Sometime in 2022 that our country will get there. But as the Omicron variant has illustrated, the whole world has to get there because now new variants are going to come, you see, and could potentially cause more problems. But what you need to think about it is, unless you're a hermit or you're very lucky, either you will get vaccinated with this condition or you'll be infected with it. Those are your choices.
At some point, yeah.
Yeah, you're going to get the vaccine or you're going to get vaccinated or both. And getting the disease naturally unvaccinated, you have about a 1% chance of dying. Getting vaccinated, you have about a 1 in a million chance of dying. So it is from the vaccine. So it is a no-brainer what the rational choice should be in terms of those two alternatives. And
wait, can you go back to that just for clarity? 1 in a million chance of dying from the vaccine.
Yes.
So the latest I've seen is, these 3 cases of myocarditis after the vaccine that led to death. Where is 1 in a million coming from? I've not heard that.
I'm saying it's less than 1 in a million.
Oh, I'm sorry, less than. Okay, yeah.
The order 1 in a million. In other words, what we, from a public health point of view, we always tolerate some risk of death from vaccines, right? The idea is you give a vaccine, you save 10,000 lives, and you lose 1 life. And, that's a trade-off that you make with any public policy,
Sure.
with how you build your roads or how you secure the safety of your factories. These are always issues. Like there's some downside and there's some upside, and you want the upside to be vastly higher than the downside, which it is with vaccines. So these vaccines, these coronavirus vaccines, are exceedingly safe as vaccines go, far surpassing typical standards. And they're far better than getting the disease naturally, which poses a risk of death. Anyway, the point is that everyone is going to either get vaccinated or get the disease, and when that happens, then we will have reached this herd immunity threshold, which will be sometime in the next few months in our society. This is assuming we don't get new worrisome strains of the virus that can evade the vaccines or otherwise are more deadly, for example, which could muck up the works of what I'm saying. But anyway, So we're going to get to that point soon. And I think that is going to be one landmark of when we can, quote, return to normal. Now, we're not going to immediately return to normal because think about it this way. It's like a tsunami washes up ashore and devastates the countryside. Well, eventually the water recedes. That's great. The sea level has returned to normal. But the countryside is devastated, right? There's a huge mess that needs to be cleaned up. And that's a little bit of what's going to happen to us. When we pass into the intermediate phase of the pandemic after we reach this herd immunity threshold, we're going to have had millions of children that miss school, millions of our fellow citizens that are disabled, as we just said, tens of millions that are grieving the loss of loved ones, millions of people who've lost their jobs, millions of businesses that have gone out of business. We were borrowing trillions of dollars against the future to kind of soften the blow right now. We're going to have to repay those debts. So all of that is still going to affect us. It's not going to be like a sudden, oh, we're just back to normal again. So that's going to take some time as well. Anyway, I think I understand people's desire to return to normal. I understand the fatalism that says, well, what can you do? The world has changed. There's this awful virus. But I would say that we don't need to tolerate needless deaths. Just because a fire is raging doesn't mean you need to say, well, when these fires rage, many houses burn down, and what can you do anyway? No, you're out there with your hose,
right.
You're hosing down your roof, and you're hoping that your house doesn't burn down. And I think those steps are prudent steps, and steps we should be making with respect to the pandemic as well.
What are you not doing now that you were doing before the pandemic? Like, how have you set your level of what you do and what you don't do?
I'm not as, I do, first of all, I'm triply vaccinated. And I would encourage people to get the booster. There is some preliminary evidence that the booster will also help with the Omicron variant
yes.
as well. And although in general, vaccine efficacy will decline. It declined when the Delta variant came. So roughly speaking, the vaccine was, let's say, 95% effective against the original Wuhan strain of the virus, maybe 90%. We're talking about the mRNA vaccines now, 90% effective against Delta. So it lost some efficacy, but still, a 90% effective vaccine is a very effective vaccine. That means if you get infected with the virus, it'll lower your risk of death by 90%, let's say, which is amazing. And probably it'll be lower than that for Omicron with the existing vaccines. The manufacturers are racing to produce new customized versions of the vaccines.
Yeah.
And we should, by the way, we should welcome that. I don't think you should say, oh, look at those pharma companies. They're trying to get me to take more vaccines. Well, no, we're lucky that they can make these vaccines. Just like tetanus, you get a tetanus shot every 10 years. That's a prudent thing to do.
Yeah.
So I lost my train of thought. What was
in terms
saying?
of what you're not doing at this point.
What I'm not doing. So I'm triply vaccinated, which is sensible. I still wear a mask when I go to crowded indoor environments with strangers. I am seeing friends and family in my house who I know to be vaccinated, with, of course, without masks. So I am resuming sort of small-scale social interactions with known individuals, and I'm minimizing some other things. Like I don't travel as much as I used to, for example. I don't, I do go to indoor restaurants, but not as much as I used to. I'm just sort of, I still haven't fully, resumed my previous level of social interaction from prior to the pandemic, unfortunately. And I look forward to being able to, honestly. I'm fed up with this. I find wearing a mask really tedious and irritating. Yeah. But I think it's a prudent precaution.
Yeah, no, it sounds like you're basically doing what I'm doing. And even with the indoor restaurants, I was talking to my girlfriend the other day. I was saying, for me, I'm not doing this because people wear a mask while they order and walk to the table. I'm just evaluating, is it a really crowded restaurant with tables close together or not? Like, if it's not, I don't really care about the masks to walk up to order. That seems, I don't know.
Yeah, plus you're young.
Yeah.
And it's a brief, you're only in the restaurant for an hour. I mean, these are all, the thing about life during a time of a pandemic is that it's all shades of gray. These are all relative risks. There's no life with no risk.
Yes.
And so, you might, going to an indoor rock concert where people are yelling and screaming for 2.5 hours with 20,000 people is different than going with your girlfriend to a hushed tones restaurant, for an hour.
Yeah.
It's different. And it's different if you're 80 and immunocompromised and if you're 30 and healthy. It's different. And so, I think if people are prepared to think that way and to understand that there are degrees of risk, and if they're also willing to do their part, right? This is the other thing that's so irritating to me about the anti-vaxxers is that to the extent that we all get vaccinated quickly, then we can all resume normal life more rapidly, right? Like if we get our vaccination level up to 85%, like the Portuguese did, for example, then we don't have to stay 6 feet apart anymore when we go to the supermarket, and we can begin to resume more normal life. But
Yeah.
in a way, we are shooting ourselves in the foot by not availing ourselves of this technology, which, by the way, is one of the hallmarks of American science and capitalism. I mean, one of the things that upsets me is that we did not bring our best game to this fight. The Chinese are an authoritarian government, and they have a kind of collectivist culture, and they use their tools to cope with the virus. I would not be happy to live in China under the constraints that are in China, but those are the strengths the Chinese had, and they're effectively controlling the epidemic. Now, we could not have done that in the United States, but we had money and science, and we invented vaccines very quickly. Why on earth wouldn't we use them?
Right. The biggest advocates of the system that
Yes.
that allowed that are now saying, I don't want it.
Yes, it's odd, right? It's like and also it's a little immature. Like, what do you expect? You expect that your neighbors will be dying from a contagious disease. You're facing a risk of death from a contagious disease, and nothing will be asked of you.
Right.
Really? We're going to have to pay more taxes. We're going to have to run risk of death. We're going to have to wear masks. We're going to have to get vaccinated. We're going to have to do a bunch of inconvenient things because our world has changed. And I think it's immature to sort of fantasize that nothing is different. Now, again, that's a different point I'm making than the idea that at some point we're just going to have to accept it. But I hope we would get to that acceptance point with the least amount of death.
Right.
And I see a lot of needless death in our society right now, and it saddens me.
So on Omicron, briefly, Friday, it's front page news everywhere. Dow is down 2.5%. Very, very dark. Then we start asking the questions we should be asking. Is this more transmissible? If you get it, is it more likely to put you in the hospital? If so, is it more likely to kill you? Do the vaccines work? Like all the same questions that we always ask. This time, the panic dialogue seemed to accelerate more quickly than in the past, even though, as you pointed out on Twitter, it's not really clear that the answers to those questions really justify that, as far as I'm understanding, as of the conversation you and I are having right now. In 24 hours, we may know more about it. What do you think is going on around Omicron specifically?
Well, like you, I follow the news. I mean, the WHO declared it a variant of concern on the 26th. The first reports were emerging in South Africa about 2 weeks earlier in mid-November.
Yeah.
We know from genomic analyses that this variant probably first arose early October. Plus, we know that from some typical epidemiology. And so when this sort of hit the popular consciousness on Friday, I wanted to take my time before I offered any thoughts on the matter and not panic and get a chance to review what is known. And we already know a fair amount about Omicron. We do know in detail what's happening in South Africa. We have a lot of genomic information. We have a lot of technical information about these mutations because we've seen them in other variants. We have now some anecdotes around the world of specific circumstances, sort of reasonably well-studied situations. These 2 plane loads of people that arrived in the Netherlands, 13 out of 600 people were positive for Omicron. That gives you a little bit of a hint as to the prevalence of the disease in South Africa. So you can piece all these clues together, which took me some time to do. And to formulate a provisional opinion as of November the 30th about Omicron. So my opinion is that this variant probably is roughly as transmissible to somewhat more transmissible than the Delta variant. It's more intrinsically infectious, or as intrinsically infectious as Delta, approximately, or slightly more intrinsically infectious than Delta. I'm pretty confident about that. So that's bad. The hints in the data are that it's probably not more deadly than Delta. We don't know for sure. I'm not as confident about that prediction.
Yeah.
But I think that's likely. And on the so-called immune escape, does it evade the vaccines or not? It's too early to tell. I think it probably significantly reduces the efficacy of the vaccine in terms of spreading, and somewhat reduces the efficacy of the vaccine in terms of killing you. But I'm not confident about those assessments, and it will take a few weeks. We'll get some hints within a couple of weeks from in vitro studies, and then a couple of months or so before we begin to see epidemiological studies that assess this. So it's likely the Omicron variant reduces the efficacy of the vaccines, but by how much we don't know. And against what outcomes? Is it infection? Is it serious illness? Or is it death? We don't know. And keep in mind, what we really care about is death. So if the variant reduces the ability of the vaccine to keep you from becoming infected, that's bad, but not the end of the world if you nevertheless fight off the infection.
Sure.
But what we really are curious about is by how much will the Omicron variant reduce the ability of the vaccine to prevent you from dying? And that is unknown. It's clearly going to reduce it some, but how much we don't know right now.
Last thing, when you hear an anecdote like some of the ones we're now hearing about Omicron, I'm curious whether you even pay any attention to it. The specific anecdote I read about today is in Hong Kong, in a hotel, one person with Omicron opened the door to accept room service, and the person across the hall ended up getting sick. And of course, you start imagining a cloud of Omicron droplets somehow hanging. And when you hear something like that, is that even actionable in any way? Do you think about that at all?
First of all, yes.
Okay.
I'm familiar with that case. In fact, I put it in my Twitter thread and I studied it from what's publicly known about it.
Yeah.
Look, in early days like this, when we're like 4 days out from it being declared a variant of concern, you're looking at the tea leaves, right? You get anecdotes like that, and you look at all the anecdotes that you can find, and you try to get a hint, like what is the behavior of this virus, and that anecdote is consistent with the virus being very infectious, right? That it's very easily spreadable. Here you have a quarantine hotel. There are 2 travelers that are in quarantine for 2 weeks. They're being tested every day or every other day. They're testing negative. Then one of them tests positive and is whisked away to the hospital. And then 4 days later, his across the door hall neighbor tests positive with the same variant, and they trace it back, and they see that it appears to have spread when the first person briefly opened their hotel room door unmasked, and the virus, spread across the hall. And by the way, something similar happened in 2003 with the SARS-1 epidemic at a different hotel. I discussed this case in detail in Apollo Zero. It's a very, very famous case in epidemiology at the Metropole Hotel in Hong Kong. Anyway, so on the one hand, that anecdote, isn't going to specify global policy. On the other hand, that anecdote is consistent with the genomic data, with the early epidemiological data in South Africa, consistent with the idea that this disease spreads easily.
And that is what we can take from it, I guess, at this point in time. And not, I mean, I don't know how much is known about that example. Is it possible that the person providing the room service might have been the link? I mean, I just don't know enough about it.
Yeah, that's correct. We don't know very much. That's exactly right. And it's a little bit like you're trying to decipher the intentions of our enemy, this virus.
Yeah.
Based on the skimpiest of information. And it is early days still, right? I mean, obviously and again, this is to the credit of our scientists and epidemiologists and doctors and virologists and vaccinologists. Like, we have expertise in our society that is deeply expert at exactly these topics. And I guarantee you within a few weeks, we will know the answers to all these questions. And it's, again, to our credit. It's to the credit that we've invested in training all of these people, in spending money to support the research, with our tax dollars. This is what we get, and one of the things I find so weird is that the same people who are skeptical about all this use this device, which also required lots of scientists and engineers to make.
You're holding up your phone for people who are listening. Yeah.
Yes, I'm holding up my iPhone. How do you think this device was invented? The same kinds of effort that requires the invention of a vaccine. So to use the iPhone to mock a vaccine is a bit incoherent from the point of view of science.
Yeah, very much so. The book now in paperback is Apollo's Arrow, The Profound and Enduring Impact of Coronavirus on the Way We Live. New preface, afterword. There's a number of new elements.
Yes.
Yeah. We've been speaking with the book's author, Nicholas Christakis. Always great having you on. I really appreciate it.
David, thanks for having me back. Good luck with your work.
Thank you.